Nearly 40 million people will die from antibiotic-resistant infections between now and 2050, according to a new study published in a world-leading medical science journal, The Lancet. This week at the United Nations General Assembly in New York, all nations agreed to ramp up efforts to tackle this problem. And to discuss, I'm joined by Associate Professor Sanjaya Senanayake, who is an infectious diseases expert from ANU. Sanjaya, thanks for joining me. I'm really keen to hear, how serious is this problem, particularly in Australia?
Hi, Fiona. So really, before COVID, there was already a pandemic going around the world, and that was antimicrobial resistant. And it had been recognised at the highest levels of government. And we certainly got sidetracked by COVID, understandably, but it is still a big problem. So it's less than 100 years, almost 100 years since Alexander Fleming discovered penicillin. And within 100 years, we're seeing a lot of bacteria becoming resistant to antibiotics. So things we take for granted, going to see a GP with a sore throat or an ear infection, or being desperately ill with sepsis in hospital, there may be some situations where you can't get antibiotics and you just have to rely on intravenous fluids, for example. Now, this has been going on for as I said, building up over the years. Potentially 5 million people a year are dying associated with antibiotic resistance. And it's due to lots of causes, not just humans receiving too many antibiotics.
So what are some of the other causes? Why has it become such a problem?
Yes. So apart from certainly humans receiving too many antibiotics at the hospital level, in general practice, that contributes as well. But the vast majority of antibiotics given in the world, in countries like Australia, the US, the UK, they're actually given to animals. And from animals, resistant bacteria can jump over to us because obviously we have close contact with farm animals in terms of direct contact, if you work on a farm, and of course meat, eating, consumption of meat, etc. Then there's also antibiotics getting into wastewater from factories, and just you have bacteria sitting in waterways which are marinated in antibiotics, and then they make their way to us, and we were limited in terms of the antibiotics we can use. So there are lots of different problems. It's a multidisciplinary problem. It needs a multidisciplinary approach at the highest levels of government.
And you mentioned a couple of the illnesses a moment ago, but what sort of diseases are becoming resistant to antibiotics?
Oh, look, any bacterial infection. So whatever bacteria can do to you, whether it's a middle ear infection, whether it's meningitis, whether it's pneumonia, whether it's septicemia, all those potentially can be due to a resistant organism where we have very limited or no antibiotics. And Australia's not too bad compared to some parts of the world. Southern Europe, for instance, and certain parts of Asia, they've got very high levels of antibiotic-resistant bacteria.
What could actually be done to tackle this issue?
Yeah, so as I said, it's not just a single step. We have to do a whole lot of things. So what we need to do is we need to make sure that at the general practice level, at the hospital level, in the setting where I work, that we prescribe antibiotics responsibly. So we only give antibiotics to people who need them, and the most narrow spectrum antibiotic. So that's really important. At the agricultural level, we need to make sure that antibiotics are used responsibly there too. So that's really important. And making sure we've got good environmental regulations in place so that these antibiotics don't spill over into waterways and cause problems, and that we have good, in other parts of the world, basic hygiene and sanitation in healthcare facilities. And we also have to do other things like make sure that we get more vaccines in place so we can prevent infections happening that require antibiotics, and getting better, quicker diagnostics. So if someone gets really sick, we know very quickly what the bug is, and we can use a more direct antibiotic, a narrow spectrum one, than a very wide spectrum one.
Thank you so much. Great to get your insights. That's Associate Professor Sanjaya Senanayake, who is an infectious diseases expert at ANU.